Yeah, so tell us, what's a problem, technology, opportunity, or maybe an issue that not enough people are talking about?
Well, everybody's talking about AI, so I won't do that. But I really think, at the core and the heart of healthcare has always been the relationship between the provider and the patient, the consumer. And, I think a lot of times we talk about the technology and think about it as a technical problem. In reality, it's people. And so I think, we can talk a little bit more around that core relationship and how we optimize it, how we improve it. And in today's world, with the rise of consumerism, post-pandemic, the financial pressures on providers, there's a real balancing act to be had between how do you optimize that consumer workflow that we all desire with what the demands are in the healthcare ecosystem, which providers are really stressed with. So I would say that's the topic I would highlight.
Well, at Point-Click Care, one of our main parts of our business is supporting the long-term post-acute care business. And we just think continually one of the challenges is really we need to drive thinking about true care coordination, which is not just about making data show up when someone goes from the hospital into the senior care setting, but really how do we take that friction out of care to help empower the caregivers on both sides to put the patient in the center of all things we do.
Yeah, I think one of the main ones that's top of mind for me, and one of the reasons we're here as a company, is digestive health, gut health is really coming up in the surface. It's been long stigmatized. It was mental health 5 years ago. Now everyone's talking about their mental health. A lot of people still aren't comfortable talking about their gut health. It's poop, it's having acid reflux, all those things, but it is something that so many people, 1 in 4 Americans, are dealing with on a day-to-day basis, and it's something they can't shut off. And they're not finding the answers they need. The system really isn't set up to support them, and so we're so excited to be here to really carry on that message and introduce people not only to the fact that this is such an issue, but also the innovative models that can be used to address this crisis that has been hidden behind the scenes for so many years.
So I don't know that not enough people are talking about this, but I think it's a huge issue, and it's something actually we need to be talking about more, which is basically coverage and reimbursement for telehealth services. I think that we saw a lot of movement during COVID, and we saw a lot of commercial insurers actually move toward covering more telehealth services, and we saw Medicare increase coverage for telehealth services, but we need more. And in fact, in the past few days, there have been a couple announcements about rollbacks for telehealth coverage, and that's exactly the wrong direction. We need more coverage, not less.
So I think one of the biggest things to talk about now is just how hard it is for patients to move their health data from one place to another. I just had a kid with a really complex congenital heart defect where I had to move from Portland down to San Francisco to have a surgery done. And it took me better part of 3 weeks to move the data back and forth. And at this point, we've done a really good job passing regulations to make that easier, but the actual true linkages haven't happened yet. And I think we're at the stage at this point where you really could fix it, and it's really worth the time to do so. So it'd be great if we heard more about that. And I think we could see within a year, we could fix it with the technology infrastructure that we have in place, and that would be really wonderful.
Beyond all the excitement about AI, the key thing that not many are talking about is trust and accountability. Trust is something that we have to give to our care providers and people who are receiving care. And how do we establish that trust? So this is where regulation comes into picture. It's a balance between over-regulating something versus promoting innovation. And when we talk about trust, how do we make sure we are helping AI developers operate on a real-world data so that they can increase the accuracy, and this real-world data can be used within a constraint or a guardrail. And the second aspect of it is the regulation should make sure the AI developers are sharing the inner workings of the system. So that is one way to establish this trust, that the providers can rely on the system. And the last one is the provider should have the ability to override the AI decision system. It's not just the provider, it is also the receivers of the care, that's the patients. So we need to, as an industry, we need to look at how do we bring all these pieces together, define a regulatory framework, and independent regulatory body to work on this new domain that is called AI in healthcare.
Well, I think people really get excited about AI, right? I don't need to tell you, but I think there are multiple spaces in AI. There is, for example, documentation, right? Thing like what Epic is doing in Nuance. What I'm really excited about is really care augmentation, care delivery, right? Clinical AI, the core of medicine, FDA clearances, all of that. And when people talk about the problems with AI, we talk about privacy, we talk about security. But the thing I want to talk about more is how do we get it at the hands of as many physicians as possible, as quickly as possible, especially the community, right? Which is part of our play with Mayo, right? It's not about getting the care with Mayo who already have the best care. How do we get it in the hands of the community hospitals where they need the help the most? So AI has the potential to literally transform how care is delivered, and how do we quantify that impact and then deliver it at scale for the U.S. nation and not just at the prestigious institutions. That I think is the key.
Data collaborations, and the opportunity really is for organizations across the healthcare industry to be able to partner together through a common language of data. I think together there's a lot more we can accomplish. I'd love to see more provider organizations, life sciences organizations coming together to further patient care, and do that through research and the potential for new medicines.
Yeah, in healthcare, there's so much sensitive data, John, from large hospitals trying to protect all of their data infrastructure. And then you go to pharmaceuticals, clinical trials, drug discovery, and there's all this sensitive data. And there's one problem and challenge is protecting that data. But two, there's a huge opportunity that's missed where you can unlock value out of that data. But again, the data is sensitive. It often has PII, patient data, healthcare data. And so how do you keep that secure, again, and still unlock value? And with fully functional data and use encryption, you're now able to do that. So what does this mean? You can run AI and ML models on that data. You can run analysis on that data, learn new predictive insights that drive better patient outcomes, faster R&D, faster research for all of these subvertical areas. And you can actually start to visualize those kinds of things in tools like Tableau. And the output of that and the visualization and dashboards, that's all in plain text. But all of the analysis, it happened on encrypted data. And so that's all secure, and now you're able to share these reports and dashboards externally within your organization as completely compliant with HIPAA, with GDPR, and all those regulations. The other opportunity is cross-border, across the world, in data sharing. You can now enable inter-organization sharing, external data collaboration. So two parties or organizations can come together and pool their data and share that data for faster research, for faster R&D, drug discovery. And then the last piece is really the ROI and the outcomes from this from a business standpoint. You're de-risking, you're preventing data breaches. Even if you have a breach, anything that gets leaked is encrypted, so no one can make any sense out of it. And then you're lowering costs, anywhere from HSM costs, energy costs, all of that cost is being driven down. And then it's opening up new revenue streams because you do have these new insights from the AI and the ML. And so better insights, more predictive analysis, and we're trying to drive, a better future in healthcare.
Awesome. Thanks, Risha.
Yeah.